Hi, Dr. Stewart here. I'm going to be going over the models that we'll be using on the practical exam. If we actually get to do it as a live practical, you'll be using these models. Otherwise, I'll take pictures of them and with numbers on them and stuff, and we'll somehow do it as an online test. You're going to want to have this sheet that is on your Canvas site that is called Pulmonary System Structures to, this is a digestive one. Let's try that one. I'm going to do both pulmonary and digestive the same way. There's a pulmonary system structures to know. And these are the ones, just like before, there are a number in your lab manual that I won't be asking about because they're too minor. And so, especially since we're doing the same practical for pulmonary and digestive at the same time, I'm not doing tons of little tiny structures, although it may seem like it. But in fact, I'm going to do the most important ones, and those are the ones that are on this list. So I'm going to go through right now and hold up these structures in front of the camera so that you can see which ones I'm talking about. Turn it down about there. Oh, actually, I'll turn it up here because if I do the nostrils and the septum, as I pointed out in the lab the other day, the nostrils are the, where the air comes in. They're on either side. You have a right and left nostril, but it doesn't show on these models very well. The nostrils, I could put an arrow right through there, and it would go in one of the nostrils. The septum has been removed so you can see the structures inside. So for nostrils and septum, I would most likely use a photograph for that. Now I'll turn it down some so I can hold it up easier. The conchi, remember, are these structures here. Actually, the bones underneath are more commonly referred to as conchi, and the entire structure is called a turbinate. These are the turbinates, and they are designed to bring air in from the front, from the nostril, and move it around over these turbinates to moisturize it and filter it. These turbinates also have a tendency to block your sinuses or block your airways, and sometimes if you have a deviated septum type surgery, they'll carve down these turbinates to make you able to breathe a little bit better. You have an upper, middle, and lower, or superior, middle, and lower turbinate. Okay? In the back of your, the roof of your mouth is also the bottom area of the nasal passages. These passages in structures in your throat may be asked as a digestive structure, but since it's the same practical, you need to know them anyway. The hard palate is the hard roof of your mouth. The soft palate is this muscle back here that is able to contract and pull up and help block off your nasal passages when you swallow so food doesn't go up your nose. The uvula, the little hangy down off the back, is this last piece that sticks down. It's the piece you can see in the back of your mouth. The hang down thing is called the uvula. It just gives you some more tissue that can spread out and help cover up those air passages when you're swallowing. Your tonsils, you have 3 sets of tonsils. The ones up here, what they call them in your book, pharyngeal tonsil. I mean, this is all the pharynx. This is, by the way, this is the nasal pharynx. The pharynx is the back of your throat. The place behind your nose is the nasopharynx. Behind your mouth is the oropharynx, the part you can actually see when you look back in there. And down a little bit farther is the laryngo, meaning larynx, laryngopharynx. So your pharyngeal tonsil is up here. They're also called adenoids. Sometimes they give people problems. On either side of the back of your throat, where you can see if you haven't had your tonsils out, those are the Palatine tonsils. Those are the ones you usually have out if you have tonsillitis. If you have them out at all. And on the back of your tongue is another tonsil all the way down here called the lingual tonsil. And tonsils are immune lymphoid type tissue, like lymph nodes. They have a lot of B and T cells in them that help fight infection. And since you breathe in and eat bacteria and viruses and stuff all the time, they're there to try to help protect you from that. Going down a little bit farther, we have the larynx. And the larynx is where your Adam's apple is. Adam's apple here. And it's the whole structure here. So if you look at the bigger model of the larynx, here's the larynx. On top is the hyoid bone. It shows on here because there are muscles and things here that help elevate the larynx when you're swallowing or speaking and you need to change the position of the vocal cords or assist in swallowing. So the hyoid bone, which you know from last semester A&P1, is up here. This whole structure then is the larynx. Structures to know. This is called the thyroid cartilage. Your thyroid gland is actually this big guy down here. He's below that, but they gave that the name the thyroid cartilage. These are the arytenoid cartilages. They actually help work the vocal cords, and they look like the predator or something like that. These guys here that are movable, and they help to actually activate the opening down to your airways and control the vocal cords. Now on these models, you'll look in your lab manual and you'll see that it'll show the vocal cords, it'll show the vestibular folds on the top and the vocal cords just below them. The vestibular folds look enough like vocal cords that they call them false vocal cords. But on this guy, it's only got one set. So on the test, they may think that these are vocal cords on this model. I don't know what they had in mind. I've always called them vestibular folds because they're the ones you can see. But if I ask you that question, the answer set will not have both vestibular folds and vocal cords on it. So it's either one or the other because that's exactly where they are, but there are actually two sets of them, one that's on the surface and one that is slightly below that. The vestibular folds or false vocal cords, and then the real vocal cords. Your epiglottis is this flap here, and it may show, for instance, on this guy, you can see the epiglottis right here. And what it does is it closes off the airway when you swallow. I can't get in the picture here. Yeah, there we go. Closes off the airway when you swallow to keep food from going into your lungs. It's open almost all the time because you breathe more than you swallow. It just closes when you swallow, steers the food down your esophagus instead of going into your lungs. The glottis is not well described on here. The glottis is down here. It's actually the opening to the trachea. The epiglottis covers up the opening to the glottis, so it's a little farther in. I might be able to point that out on the picture, but I wouldn't point that out on this model because it doesn't really show it very well. So the epiglottis would more likely be shown on here than the glottis itself, which is kind of vanishing from this guy. Hyoid bone. Okay, so then we get to the bronchial tree itself, and we have the trachea. You only have one trachea. Here we go. One trachea. You have the primary or main bronchi. You have a right and left, bronchus. Bronchus is one, bronchi is two. Since we have 3 lobes on the right and 2 lobes on the left, you have 3 lobar bronchi, 1, 2, 3 on the right. You have 2 lobar bronchi on the left. And when you get out to these little colored guys, these go out to the segments. The segments in the lung are parts of each of the lobes. So these, just in general, the colored ones on this model, which is the one I would probably use for that structure, are called the segmental bronchi. So trachea, right and left primary bronchi, lobar bronchi, segmental bronchi. Let's go. Oh yeah. These are the tracheal cartilages. Each of these circular things going around here is a tracheal cartilage. In between them are called annular ligaments. They go all the way around like this between the cartilages. The cartilages are the hard blue things, and the ligaments are between them. So you have the tracheal cartilage, the annular ligaments, and on the back, you have what's called the membranous wall. So the cartilage doesn't make a complete ring. It instead comes most of the way around and has a membranous wall that gives a little bit more flexibility to your airways. Now we hit a couple of things on this list that I don't have a model for, and if I put them on the test, they would have to be as a picture form. But these are in your PowerPoints. For instance, you have the pseudostratified columnar ciliated epithelium. Remember, the linings of your airways are these columnar epithelium with cilia on the top that are constantly moving debris out of your lungs toward your mouth. So that is the kind of epithelial tissue that lines the airways. So remember that. Couple other things on here, I think. Oh yeah. When you look at the lung itself, remember that there is a double layer of membrane with the pleural space in between it. The visceral pleura, visceral means organ. So the visceral pleura is actually a layer of connective tissue that surrounds the lung. The parietal pleura is the layer that's on your chest wall, and the space between them is the pleural space. So it's like wearing 2 pairs of socks. You have one against the lung, one against the viscera, one against the chest wall, and the space between the two is called the pleural space. And that's what needs to be kept vacuum sealed, otherwise you get a pneumothorax, your lung collapses. Lobar second. Okay, so we're going to look now here. We get a little bit farther down. We have this is a alveolar cluster down here. You've got the bronchiole coming in, bringing air in and out. You have arteries and veins bringing the blood around that alveolar cluster so that you can get it oxygenated. And some of the parts, this is a bronchiole. It's a fairly small bronchiole. When you get down to the last bunch of bronchioles that don't actually have alveoli on them, those are called terminal bronchioles. Terminal bronchioles are these little guys, the last layer of bronchioles that doesn't have alveoli stuck on them. The respiratory bronchioles are so far down in there, they're all surrounded by alveoli and they don't show up very well on this model. On your PowerPoint, you have a good diagram of a respiratory bronchiole. So if I put that on the lab practical, that's what I'll use. I'll use a picture like that shows the respiratory bronchioles that actually have the alveoli stuck onto them. Then you have arteries and veins. Now remember, in the pulmonary system, you're coming in with deoxygenated blood and going out with oxygenated blood. So the colors are backwards. This is a pulmonary artery bringing deoxygenated blood, and it branches into pulmonary arterioles that would constrict and dilate to determine how much blood is going past those particular alveoli. The red ones coming back are pulmonary venules that join together and become the pulmonary veins that would become bigger and bigger and bigger and go back to the left atrium. So pulmonary arteries, pulmonary arterioles, pulmonary venules, back to pulmonary veins, going back to your heart. Remember, on the PowerPoint, we also showed the structure of the alveolus itself inside the alveoli. You have the type 1 epithelial cells, which are the squamous cells that just allow gas to go back and forth, the flat guys. Then you've got the kind of big, bulgy guys that are the type 2 pneumocytes that make pulmonary surfactant that we talked about to help you breathe in and out. So the type 2 pneumocytes, they're bigger, they're darker, and they have like little villi on them almost, and they make pulmonary surfactant. And the third thing you have in there are the pulmonary macrophages, or dust cells, that help to clean out your lungs. Now those are the parts of the pulmonary system. Remember, as in with all of my practical exams, you'll also have a couple of questions at the end that talk about the things that we did in my physio things. The breath test we did, the lung volume things, you know, if you add these together, what do you get? If you add those together, you get the total lung capacity. You know, what can you test with the spirometer? Well, you can test what you can breathe. So you can test the tidal volume and the inspired and expired reserve. You can test the FEV1, which is the amount you can blow out in 1 second. Remember, that should be 80% of the FVC, of the total amount you blow out. So look over your notes from those physio-type labs and make sure you can answer a couple of questions about the most important things that we looked at on those days too. Okay, I'll make another one of these for the digestive system.